In a world of constant change, true leadership remains an enduring beacon. Doug Struyk, who recently retired as CEO of Christian Health, built a legacy that we will remember and celebrate well into the future. For the past 34 years, Doug has been at the helm of our organization, leaving an indelible mark on Christian Health and every individual he encountered. We spoke with some special individuals to illustrate the impact and legacy he built during his time at Christian Health.
Doug Struyk is guided by his own North Star. It's tied to morals, it's tied to ethics. He's a guy that says, where do we want to go, where should we go, and how do we make it happen?
He's involved in a lot of organizations. He keeps up with what's happening in the industry through his memberships, and that helps build the organization into what we need it to be.
Being a leader in healthcare is a really, really important job. And what I think is critical, and what I think Doug portrays.
He puts his organization first, he puts his people first, he puts his patients first, his residents.
He is a man of deep and abiding Christian faith, and truly an exemplar of a Christian leader of an organization.
Doug is, for me, Christian Health. It would not be what it is without him and his vision and his leadership.
After joining Christian Health in 1990 as Vice President of Finance and Chief Financial Officer, Doug became President and Chief Executive Officer in July of 1994. With a sharp eye for innovation and an innate understanding of healthcare regulations, Doug used his God-given talents to position the organization for success.
I think Doug's legacy to all of us is that you don't stop. When you think you have a really good product, there's always something else that can be done so that we can continue to always provide for the needs of the people that are out there looking for one more thing that they need for themselves, for mom, for dad, for a loved one needing psychiatric care. And just don't stop looking, because there's always going to be somebody else who has something that we have to help them with.
With everything we do, every project that we worked on, every initiative that we undertook, we really looked at how do we provide that great compassionate care.
Watching new programs come on campus, watching Heritage Manor West be built, the Bolger Gym, Ramapo Ridge Psychiatric Hospital, Longview Assisted Living. We've added so many programs, but we've also beautified the campus.
It's night and day what the Christian Health was 34 years ago, what it is today. You'll get a picture on the wall sometime, and they'll say, "Who is that man?" And we'll say, "He's the legend."
The GOAT.
The GOAT, the GOAT. There you go, the greatest of all time.
During Doug's tenure, Christian Health significantly expanded its programs, services, and geographic footprint. This included significant building and transformation in Wyckoff and the addition of new campuses in Wayne and North Haledon. Our continuum of care for older adults grew significantly. We opened new communities for independent living, including several affordable housing options. We also built new communities for assisted living, memory care assisted living, special care skilled nursing, and short-term rehab. The Vista opened, a landmark project 20 years in the making. We also provided adult day services, outpatient rehabilitation, and home care, and welcomed Winmere and Newbridge services to the Christian Health family. With Doug's steady guidance, we significantly expanded outpatient mental health services, renovated our inpatient mental health hospital, introduced New Jersey's first women-only inpatient trauma care program, opened a partial hospitalization and intensive outpatient program, and partnered with Valley Health System to create the Vail Ridge Center for Behavioral Health and Wellness.
Doug was very passionate about meeting the needs of the community from a behavioral health perspective. We feel at Valley that Christian Health is a partner.
We have been able to enhance the services that we provide to our patients, and being able to do it with Christian Health is just perfect.
Doug set new standards for excellence at Christian Health, introducing numerous quality control committees, In addition to his operational achievements, he spearheaded philanthropic initiatives, supported educational programs, contributed richly to local nonprofits, and heartily supported our first responders. Doug maintained that success should be shared and that we all have a responsibility to give back.
It was not unusual to find him in snowstorms going out and picking up staff. Not unusual for him to come in on a holiday to thank them for stepping away from their families so that they could be taking care of, our residents and patients.
He'll do anything that needs to be done. For example, when COVID hit, he was there in the evening helping us pass trays. He's one of the team.
When my husband was dying of brain cancer, and I had to retire from a committee that I enjoyed working on very much. But Doug had a little luncheon for me, and somehow he found out what my favorite foods were, and he had that at the luncheon. And he invited 4 very special friends to come to the luncheon. He cares about people's needs, and he knows how to deliver them. And he's done this with this facility. And I am now a resident of it, so I'm experiencing what you did, Doug. And I'm loving it here.
When we purchased Summer Hill, we had a meeting with all the residents. And what really, hit me hard was one of the residents coming up to me and said, without this place, I would be homeless. And that is really what I think Doug's legacy is, that it's enabled us to look at and see the effect on those that we take care of.
I'm amazed by the thank you cards he sends to all the staff.
I think Doug wrote close to 800,000 thank you cards over his career.
You don't see CEOs doing that. He made sure that he was connected to the staff, that he knew them by name, and that there was a real authenticity and genuineness to his care of every individual.
As his guiding light, Doug relied on his faith, family, and commitment to Christian Health's vision to be the hands of Christ through expressions of mercy and love. He led with empathy, fostering a culture of collaboration and respect. His hands-on approach saw him visiting residents and patients regularly, consistently demonstrating his servant leadership.
My dad was in hospice at Christian Health. We had a conversation about what he would like his funeral to look like. And he asked that Doug be one of the speakers to eulogize him at his funeral, which I think was indicative of the tremendous respect and affection that he and my mom had for Doug, that developed over all those years that they served as volunteers at Christian Health.
We're there for a reason, and the reason is the residents. And so interacting with the residents, meeting with them, enjoying their company, that's what gives us the energy to go back and do it again the next day. In my opinion, I think it was what refilled his cup.
Doug has made sure that the mission and vision is something that is very much a part of the legacy of Christian Health. And so it sets a path and sets a journey for a future that will respond to the needs of a community much like it has over 100 years.
I don't think Doug's going to slow down. We used to call him the road runner. He was always go, 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 go.
He's an amazing record keeper. So the final board meeting that we had with Doug, he knew exactly how many board meetings he had been at in all of his years at Christian Health.
It was amazing.
And he knew how many he'd missed. And it was an extraordinarily small number that he'd missed. I think it was like 2 or something,
Yeah, it was
right?
very small.
Doug was a great guy. How many years did he work here?
34 years.
Gosh, seems like yesterday.
Doug, you've made a difference in big ways with an expansion in the organization and the construction of new buildings, and in thousands and thousands of small ways with residents and patients and clients and staff members and volunteers and people in the community.
I've never met anyone that was more passionate and more innovative when it came to long-term care.
God made the right choice in choosing you to be the leader because you've done it so successfully, so beautifully, and so tenderly with that servant's heart.
Doug, it has been such a joy for me to have you as a colleague and a friend, and I wish you all the best as you start moving into your next chapter.
You've done it all. You're the whole package. And I am so grateful for your mentorship, for your guidance, your advice, but I'm also just so grateful for you. And I have to thank Vicki for loaning you to us for so many years.
She is very much a part of the success of that organization as well.
I don't know what Vicky's going to do with him for all these, all the free time he's going to have now, but that's life.
We hope that Doug will be able to enjoy retirement, enjoy many years together with his family, watching his children succeed and grow and enjoying grandchildren and great vacations. And yeah, we hope to join you soon.
Doug, it's been a real pleasure, and I thank you for the opportunity of being able to work together.
I'm just going to miss him terribly. He knows that. I've told him many times already.
I miss you, Douglas.
Thank you, and enjoy your wonderful retirement.
Doug, your leadership has lit the way for a bright future.
You've instilled in us the mission and vision of our organization,
inspiring us to be the hands of Christ for others through expressions of mercy and love.
Your legacy will live on through the team you built,
the many lives you've touched,
and the exceptional care and services we continue to provide.
Thank you, Doug.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Doug.
The other aspect of being a really good leader is leaving your organization when you retire in good stead. And what you have done is cultivated a very strong leadership team. Steve will do an excellent job. I'm confident in that. And I think that you've done your job in creating the succession plan. So congratulations.
Being able to have brought the organization to a point, but know that it's going to continue to grow and to continue to provide great care for the community, I'm sure is so gratifying for him.
Well done, good and faithful servant.
34 years of bold leadership, guided by faith. Countless lives impacted and communities changed. A lasting legacy